Hey, this is Russ. Time to hear from another knee patient. Yeah, today we're going to listen to the story of patient 18F, who's a 53-year-old woman from Arkansas. But before I tell you about her, let me tell you about me. Now, you might know that on Saturday I went in for my second Pfizer shot for the COVID-19 vaccinations. And today is Sunday as I record this, and by the time you see it, it'll be Monday. But the left arm hurts a little bit today. I could definitely feel it more today than I did after the first shot. And I think that's pretty common from a lot of people. They say that the second shot is more of a stronger effect on your arm. Okay. So I know from the first shot, I had a little bit of headaches too. Now, what I did is I took some Tylenol and I also took some Benadryl. Now, I heard a little bit later from both my sister and from my daughter, who are both pharmacists, I shouldn't have done that, okay? But a friend of mine said that her cousin, who is a nurse at a hospital, she said that all of their COVID nurses do this. Now, there's some talk that possibly the Tylenol and the Benadryl being taken after the shot could actually kind of make the antibodies that you generate be less. So maybe that was a mistake to do that, but I kind of went on what the nurse had done and what the other nurses had done, that they did that, and supposedly that makes it a little bit easier to deal with after. So I'm not telling you guys to do this. I'm just saying this is what I did. I'm wondering if I should have done it based on the two pharmacists in my family telling me I should not have done that. And my sister also said never take Tylenol and Benadryl together, which I kind of did. So too late for me, but for you guys, think twice before you do it. Read some articles. You make your own decision. All right. So I'm beginning to think maybe I shouldn't have taken it. I usually don't take Tylenol or Benadryl unless I absolutely have to, but somehow I made the decision to do it. Right. So hopefully it still gives me enough coverage. All right. So let's go on to patient 18F. I can't get this out of my mouth. Patient 18F, who's a 53-year-old woman from Arkansas. Here's what she says. And again, I'll read off camera here. She says, her surgery was done on November 25th of 2020. Now, she says she had 2 MUAs with her last one on March 25th, 2021, and she's had a lot of trouble, okay? She said since her surgery, she's had about 50 therapy sessions. Wow, she's gone quite a few, but she's got a few to catch up to me. I've had 80, all right? So she says she's gone 50 therapy sessions as of today, meaning last week, and more to come. So she might catch up to me. She says, we discovered that later I have keloid skin. I'll show you some photos here. She has keloid skin, and it's causing a lot of stiffness in my knee. No matter how hard I work on the knee, it feels like a rubber band in front of my knee, stopping the bend of my knee. Yeah. I've seen these keloid scars too, and I know that that's actually difficult to deal with. So she says, I came home with the CPM machine, and of course CPM is the continuous passive motion machine, okay? She came home with the CPM machine, and she used it faithfully, as she has 2 nurses in her family that took great care of her and made sure that she did what she needed to do to recover well, all right? So she says, we are all disappointed in the results yesterday. She was bending at 105 degrees. After the second MUA, I was measuring 117 of flexion the same day at therapy. The doctors say I have to bend to 125 degrees during the manipulation. I'm backing this up. She says the doctor said that she bent to 125 degrees on the day of the manipulation. So she did 125 in the operating room. She was getting 117 on after the MUA, but was 105 before. So 125 in the OR, 117 right after the MUA, 105 before the MUA, okay? So she says, but she's going backwards today at 105. So she went from 117 back down to 105. All right, so she says, I've included pictures of my journey. This has been a long journey, and I'm still not walking well due to the bend in my knee. The lack of the bend, we should say, really. The doctor says not to give up. If all else fails, he can go back in a year later to clean up the keloid scar tissue. So December 2021, I may be going back to the surgery to remove the keloid scar tissue. And that's really tough. I know that people have done things where they've had to do the scar internally. I don't know if they would do anything for the outside. So we need her to clear that up. Okay, so send me back an email. Let me know about that. Okay. I had no clue this could keep me from walking well. My wide scar shows keloid skin, and it is thick through and through, inside and outside. I've done everything the doctor has suggested with little progress at this point. I need relief. It's hard to walk without much bend in my knee. I'm stretching more and more every day. Now, her extension is at 1 degree because I did ask her how that was. And so my recommendation to her was to contact Joint Active Systems or some type of company that has the ability to give you some additional pushing during the times that you're not at physical therapy. Okay, so this is what I did. Essentially, I had the MUA done on the second MUA, and my doctor recommended that I get a jazz unit. And so I had the jazz unit for 2 months. That's what the insurance company paid for me. And then I returned it back to Jazz. Now, you all know that months and months later, Jazz contacted me again and asked me if they could help me with my extension. Okay. And so they gave me a unit for the extension, and then I asked them for a second unit for my flexion, okay, which I still have, and eventually I will be giving that back to them. But the whole point is that I had actually reverted backwards too, because at my therapy sessions, they pushed me to 130 degrees, but on my own, I was getting, I think maybe like 114, 117, something like that when I just pull back on my own. So in time, because of the pandemic situation, I stopped going to physical therapy. And then when I was measuring my knee, I had dropped down to 104, okay? So I started getting a little panicky about that when I saw that, I'm no longer at the ranges that I should be. So that's when I contacted Jazz again to ask for that second unit so I can do my flexion again. And that has brought me to 120 degrees, and I seem to remain at 120 right now. So this is why I'm seriously thinking of giving back the unit to Jazz, because I think I'm done with it. They have been kind enough to give this stuff to me for free, and they told me that don't worry about sending this unit back anytime soon. Keep it as long as you need to use it. So part of me says that, yeah, just keep hanging on to it. You're not paying for it anyways. They don't seem to care getting it back. But on the other hand, I also know too that by keeping it kind of forces me to say that if I need help, I can just put this unit on. I'm not going to have this forever, okay? So I know that I need to work on it myself to keep it at 120 degrees. And so far, it's at 120. So I may keep it for another week or two and see what it does. And if it continues to measure out at 120, I'll go ahead and return it back to Jazz at that point. That'll force me to keep my own exercises going. Okay, so my suggestion to her was contact Jazz, and I think she did contact them. I'm not sure whether she got a unit from them or not. I hope she does, because I think that really would make a difference for her. Because even though she's going to physical therapy, it's they're only pushing you when you're in physical therapy. Okay, who's pushing you at home? That's my question, and that's why I think having something like the Jazz unit or something, whatever you buy or rent, having something at home would help you too. Because then you can continue to keep doing it when you have time to do it versus, just going in once a day or whatever time you go for physical therapy, and then they push on you. So anyways, that's my suggestion to her. She has reached out to Jazz. I haven't heard back to find out whether she got a Jazz unit or not. And I told her that, if your insurance pays for it and if your doctor prescribes it to you, you might be able to get this without payment out of your pocket. So why not? Why not find out whether it's something that would help you or not? So anyways, good luck to her. And of course, I'm hoping that she'll keep us in contact with us so that we know what her outcome becomes, especially if, she goes in for that keloid removal thing, which will be in December. It's going to be a while. But still, as long as the channel's still running here, and as long as people have interest, and as long as I still have the ability to talk about the knee, let me know, and then we'll update everybody. Okay. Anyways, that is her story, and we wish her luck. If you want to be a knee patient too, just go ahead and look in the description. There's a link to the video that you should watch before you send it to me. But basically, if you email me at contactrussisright@gmail.com, and again, it's not russisright@gmail.com. That is somebody else. Okay, don't send it to that guy. I think he's been getting knee photos, and I'm beginning to wonder why. Send it to contactrussisright@gmail.com. And so tell me your story. Tell me things like your age, where you're from, male or female, that type of thing. And then when your surgery was, what's been happening, and if it was successful or not successful, okay, and what you're doing to help yourself, okay. All right, that's it for today. And also, I want you to take a look at this video up here. I'll put a link here. It talks about our new schedule of videos. Okay, I'll put a little thing down here so that you can take a look at that too. But this is the schedule that we're going to try to follow. So Monday, Wednesday, Fridays, we're going to try to talk about the knee, and then Tuesdays and Saturdays, we're going to do some bike videos as well as fishing and whatever else I have interest in, okay? So you can follow along that way and watch those bike videos too, because I probably will be talking about my knee as I'm biking, so you'll hear stuff about that. Plus you get to see some outside stuff besides sitting in here with me in the studio. All right, anyways, that's good enough for today. Thank you for watching. Hit the like button, hit the subscribe button, and I'll talk to you guys next time.